And with that, I will hand it over to Dr. Munkarah.
Thank you, Dana. Good afternoon, everyone. It's a pleasure being with you this afternoon, and hopefully you've been enjoying our warm summer days. I would like to begin by starting with some updates regarding our COVID numbers across our hospitals. As of this morning, we have 100 inpatients with COVID across our 5 hospitals. The last time we have seen triple-digit numbers with hospitalization was a few months ago in early May of 2021. So we continue to be worried about these numbers climbing up. Distribution across our hospitals, we have 28 patients at Henry Ford Hospital in Detroit, 25 COVID patients at Henry Ford Macomb Hospital, 17 at Henry Ford West Bloomfield Hospital, 17 at Henry Ford Wyandotte Hospital, and 13 at Henry Ford Allegiance Hospital. Of those, 77 patients are unvaccinated and 19 are vaccinated, and 4 are in between doses. This means that they've not been fully vaccinated. We also have about 100 patients who have currently COVID tests that are pending, where we might be suspecting that they have COVID in our hospitals, but they have not been confirmed. When we look at our COVID test positivity rate, we are hovering now between 9 and 10%. This morning, it was at 10.5%. Our numbers really are mirroring what we are seeing across the state. Statewide in Michigan, the infections were up 60% in the past 2 weeks, and hospitalizations were up by about 68%. So there is no question these numbers, these climbing numbers, continue to be worrisome to us. The increased number of hospitalization has not been as fast as we have seen in prior surges, but we continue to watch these very, very closely. We were very pleased yesterday by the FDA announcement granting full approval to the Pfizer vaccine. This really solidifies what we have been saying for months. We and other clinical experts, as well as vaccine and infectious disease experts, that these vaccines are safe, that they are effective, and they are the most powerful tool for us to get us over this pandemic. We are hopeful that this approval by the FDA will now prompt many of those who have been reluctant to get the vaccine to go ahead and get vaccinated. There is plenty of vaccine that's available. The data is solid at the present time. For those people who have been waiting for FDA approval, it is here. So please go ahead and make an appointment to get vaccinated. For those of you who might be interested to get vaccinated with us at Henry Ford Health System, please go to henryford.com/vaccine to make an appointment at one of our vaccine sites. We currently have vaccine sites in Troy, Dearborn, and in Jackson. Also related to the vaccine, we have started to administer the 3rd doses of the mRNA booster doses for those who, by CDC criteria, meet the criteria of being moderately or severely immunocompromised. This means that our individuals who we believe the immune system is not strong enough, and that at the present time they need an extra dose to boost their immune system, especially to have their body fight against the Delta variant. Currently, we are taking appointment only through a Henry Ford MyChart account. So this is the electronic access to your personal electronic medical record. And we are doing it also through our website at henryford.com/vaccine. We are administering these at our existing COVID vaccine clinic locations in Dearborn, Troy, Wyandotte, and Jackson. Because we know that there are many people who are interested to get the vaccines, and because our own appointments are limited, and because we know that there are plenty of vaccine availability across sites and across pharmacies in our areas where we are serving our patients, we encourage those of you who are eligible to the 3rd shot to go wherever it is more convenient to you so that you can get your shot as soon as possible. So do not wait till you get an appointment. If you desire to get it through a pharmacy or to a place next to you and get the 3rd booster shot, please do so. The City of Detroit residents can also get their doses at the TCF Center. For the rest of the population who got their first 2 doses of the mRNA vaccine and they are waiting at the present time for the booster shot, All of us have heard about the CDC guidance that most likely by the end of September, we will be opening the third booster shot for those who have had the first 2 doses of vaccine and who do not feel who do not fall into the category of being immunocompromised. So this is the rest of us. And we are starting to work on the operational logistics at the present time and the planning to be able to provide these booster vaccines to all our healthcare workers, to the frontline workers, as well as to our patients and communities who we have helped with their initial vaccine doses. At this time, also, when we are seeing an increase in the number of the COVID cases, I would like to remind all of us that monoclonal antibody therapy continue to be an option for those who have been exposed to the virus and starting to develop some symptoms of infection related to COVID. These monoclonal antibodies are infusion. It's an injection into the vein. It's a medication that's given into the vein in less than an hour. It is done as an outpatient setting, and this helps prevent the disease from getting more serious and help people avoid getting hospitalized and definitely avoid the severe complications of COVID. We also have sites for monoclonal antibody therapy at Clinton Township, Dearborn, Detroit, Jackson, and Novi. For those who receive the monoclonal antibody, it does not mean that this is a replacement for the vaccine. It does not take the place of the vaccine. It just helps people get over the acute phase of the infection. 90 days after somebody has got the monoclonal antibodies, they will be eligible to get the vaccine. And we strongly encourage people who've been 90 days post an infection or post monoclonal antibody therapy to go ahead and get their vaccination, because it's, again, the most effective way for us to get over this pandemic. So for those people who got vaccinated, stay tuned for your third booster dosing because this is coming up soon. For those who are immunocompromised, reach out to us through the venues that I have mentioned, or to any other site that's close to you or pharmacy that's providing the third dose so that you get your vaccine. And regardless of your vaccination status, let's all mask up when going indoors to public places. This is our way to get the Delta variant again under control. We are concerned about the climbing numbers of infections throughout our nation and specifically throughout our state recently. And we want to get that back under control. And our best way to do that is 1, get vaccinated, and 2, follow the protective measures of hand hygiene and masking, even if we have been vaccinated. Thank you for your attention. I'll turn it over to Bob now.
Good afternoon, everybody. It's good to be with all of you. I want to start by just echoing Dr. Munkarah's comments about the FDA's decision to fully approve the Pfizer vaccine. We knew that this was coming, and we are very excited and hopeful that it will provide some additional assurance to those that may have been hesitant. It really could be an inflection point in our efforts to get more people vaccinated. And for those who've been waiting for this decision, we hope that this decision gives you the added confidence to make an informed decision to get vaccinated. We know that vaccines work. We know that our state is in better shape than some of the other states in the country because we have had a higher vaccination rate, but we also know that we have a gap that's still concerning that we really must close. The way the Delta variant is spreading, please do not delay getting the vaccination any further. Remember, it takes 2 weeks after your second shot to get full protection. We are also making real significant progress with our own workforce vaccinations. As of Monday, we are now over 90% of our entire workforce has received at least their first dose or are fully vaccinated. We do believe that the full approval of the Pfizer vaccine will boost our efforts towards a fully vaccinated workforce. But when we started down this journey, we were at about 68%. And to be well over 90% now is something that we are very, very grateful to our team members for. We especially want to underscore the significance of vaccination for those who have children under the age of 12 and are not eligible for the COVID vaccine. Getting vaccinated reduces your risk of getting COVID and reduces the risk of spreading it to members of your family. We continue to be encouraged by the steady increase in vaccinations in general in the past 5 weeks. For the week of August 15th, we administered nearly 2,000 doses of vaccine. That's the highest volume for a week that we've seen since mid-June. So people are recognizing, and quite frankly, I think being moved by the stories that they're hearing around the country to get vaccinated. And again, with the Pfizer announcement, we're hoping that this will even increase more. While the pace of vaccinations have increased, so too is the number of positive tests, people testing positive for COVID. So for the week of August 15th, we had 452 people test positive. That's in comparison to July 25th, where we had 187 test positive. So you can see the dramatic change in just a few short weeks. The number of negative COVID tests still dwarfs the positive tests, and we should be feeling good about that in our efforts to combat this pandemic. But the increase in positive results reflect the spread of this highly contagious Delta variant, and we know that most of this is Delta by nature. It's probably in some ways hard to believe, in other ways not hard to believe, but September will mark the 18th month of the pandemic since Michigan had its first case. That's really sobering thought, given everything that we've been through so far. In many ways, it's time to take a gut check for all of us. Dial down the temperature, dial back the hostility, and start to focus on once and for all ending this pandemic as one team. Had we spent less time debating and more time aligning around the science and proof to fight the virus as one team, we would not be in this perpetual cycle of hospitalizations and lives changed. And I'm very optimistic that we are on the curve, if you will, of beginning to reach the kind of immunity levels that we need as a state. We don't know how this is going to play out in the months ahead, but we all have a stake in the outcome by getting vaccinated, and as Dr. Munkarah said, by masking up. Is it uncomfortable? Yes. But is it a means to getting us back the freedoms that we enjoyed? Yes. Both are proven public health measures, the vaccination and mask wearing, and they can beat back the virus, minimize the impact, even if someone does test positive for COVID. This is still a public health emergency, and it requires all of us to do our part. We will combat this. We're seeing great efforts. We're seeing great improvements, but we know as these variants change, we put ourselves at greater and greater risk. So stopping the cycle is really our 100% goal for all of us. So thank you, and Dr. Munkarah and I are happy to take your questions.
Thank you, Bob, and thank you, Dr. Munkarah. Folks, I'm going to go ahead and take your questions if you want to either raise your hand virtually or send me a message in the chat. The first question I have is from Karen Buffard, and it has to do with the vaccination status of the folks in our hospitals. So just to make sure everybody heard that correctly, it's 77 patients unvaccinated, 19 are vaccinated, and 4 are in between shots. Gentlemen, before I turn it over to Karen, my question for you is, what's the severity of the unvaccinated folks who are in the hospital? Are we seeing a difference in how they're doing compared to, the severity of the folks who are vaccinated versus unvaccinated?
The majority of people who are in the intensive care unit are unvaccinated individuals. We have only one vaccinated person who is on a ventilator at the present time. So there is no question that the unvaccinated individuals are showing more severe signs and represent the majority of people who are more acutely ill. Although we have one young person among the unvaccinated group, the majority of them are age 60 or above, and some are in their 80s, and they have comorbid conditions. Again, we know and realize that vaccination is not 100% proof. We know that there are breakthrough infections. We know that these breakthrough infections are there definitely with the Delta variant, but there is no question when you compare the proportionality the unvaccinated people continue to make the majority of cases within our hospital, including the vast majority of people who are in the intensive care unit and who are on a ventilator.
Thank you. And we have to be careful about patient information, but Dr. Munkarah, can you give us maybe a bracket or a decade of the person who is quote unquote younger and hospitalized with COVID? Oh, you're muted. Sorry about that. Did I mute you? I apologize.
No, I muted myself. I'm good at it.
Okay.
It is, that person is below age 30.
Thank you very much. Karen Bouffard, go ahead and open up your mic and ask your question. And then after that, I have Beth LeBlanc.
Okay, so what I understood from you is that 77 of the people hospitalized were unvaccinated and 19 were vaccinated. So that would be nearly 25%, 24.6% actually of people of the people hospitalized that have breakthrough infections. I understand there was also 4 in between doses, but just looking at those numbers, the 77 unvaxxed and the 19 vaxxed, that would be nearly 25%. So I'm wondering, does that seem like a pretty high percentage of breakthrough infections to you? And how does that compare with what's being observed nationally? And is this what was expected?
So we need to be careful on how we interpret this data, because this is at one point in time. So some of our unvaccinated patients who are there have been there for a number of days, and they continue to be repetitively counted, especially those elderly patients, versus the unvaccinated have been a younger population. On the average, we've seen about 15% of our patients being among the among vaccinated, and the rest 85% being among unvaccinated. What we provided you today is really a one kind of point in time, data that's related point of in time, and this is not a trend. It's not like we are seeing a day after day an increase in the vaccinated people being admitted to the hospital. So this is why we need to be very careful when we are sharing data, what it represents, and it presents a one day in time view.
Okay, thank you.
Okay, Beth LeBlanc, you are up next. If you could go ahead, open your mic and let us know what outlet you're with.
Hi, thanks for taking my question. I'm with the Detroit News. I had a quick question. We've been hearing from some hospitals across the state and across the nation, I think, about nursing shortages and other shortages in terms of staffing at this point in time. Are you able to quantify the shortage at Henry Ford hospitals, if there is one, and kind of talk about what you think the reasons are and what you're doing to address that shortage?
Sure, I'd be happy to take that. And actually, 6 feet outside the office that I'm in, a big job fair is going on right now, where we are inviting any nurses in to understand all the different options and opportunities that we have for them. So to answer your question, there is a nationwide shortage of RNs. There's actually a nationwide shortage of several tech roles too, surgical techs, pharmacy techs, et cetera. We have several hundred RN openings, and at a time that we are very, very busy, both with the treatment of COVID patients, as Dr. Munkarah described, and then heavy volumes in all other aspects. And so we have a lot of our nurses that have been working extra shifts, et cetera, while we work very, very hard to fill these gaps. The reasons are multi-faceted, but what I will tell you, and this is national as well as statewide, is 18 months of dealing with an incredibly exhausting situation takes its toll. Everyone at the end of the day is a human, and we have a fairly large number of nurses that have accelerated their plans for retirement. And while they were planning on perhaps working another 2 to 3 years, after 18 months of working in an intense environment with the pandemic, they came to a decision that it's time to hang it up. And then the schools were challenged as well, during the pandemic when a lot of other procedures, during the original surge, when a lot of other elective procedures and other activity was halted, because that meant a slowdown for the practicums and for nurses to get inside the hospitals, nursing students, excuse me, to get inside the hospitals. So we have a situation that is not a quick fix. And we're working together both as health systems and individually to partner with the schools to get creative and maybe get some of the individuals that just were very tired and needing a break to take a sabbatical versus a retirement, and then perhaps consider coming back after a couple of months off, and kind of all other things. But it's something that we're working on, quite frankly, 24/7.
Thank you, Bob. And folks, my next question is from Justin Hicks, and then we have Lisa. Justin, go ahead. And let us know what outlet you're with, please.
Yep, thank you. This is Justin Hicks with MLive. Two things. One of them, Dr. Munkarah, you mentioned one patient is on a ventilator who's been vaccinated. Do you know, just to kind of balance that out, how many unvaccinated people are on ventilators? And then my second question is, how important is it to differentiate between the breakthrough rate, which is that less than 1%, and that number that's like the recent makeup of new cases and new hospitalizations being vaccinated people, with that number being more closer to that 15 to 20% range?
Okay, so the first question would be, how many people total are on ventilators, so that we could put in perspective that one unvaccinated person on a ventilator?
I'm just trying to pull the most recent data that I have. I want to say we had 10 patients in the past, and I'm talking specifically COVID patients, but give me just a minute and I can look into that.
Bob, are you able to take that second question, or would you prefer Dr. Munkarah take that one?
No, I think those are more appropriate for Dr. Munkarah.
Okay, great. We'll just hold on that data for just a second then.
Yes, I am. It is 10 patients. So it is 1 out of 10 patients who are on vents is vaccinated, 9 are unvaccinated. Can you repeat, Justin, your second question related to the breakthrough infection and the hospitalized patients?
Sure. Yep. So we've heard from the state that over the last 30 days, we've had upwards of 20% of hospitalizations for COVID have been vaccinated people. And I think some folks are looking at that number and thinking that is the same thing as a breakthrough rate, whereas the breakthrough case rate, to my understanding, is less than 1% still for vaccinated people. I'm curious if it's how important it is to differentiate between those two.
Yeah, I'm not sure how people are defining the breakthrough rate, because we know that the vaccine are about 90% effective, correct? And this is even before, this is data before the Delta variant. So we know that you are going to have a 10% breakthrough based on the data that we have all along. And again, this is before the Delta variant. Because a breakthrough is an infection that happened in somebody who has been vaccinated. And the efficacy of the vaccine, the Pfizer or the Moderna vaccine, we know we're in the 90% range. So I'm not sure where the 1% rate that people are referring to is quoting.
The 1% or the less than 1% is like, so in Michigan, we've had about 12,000 breakthrough cases out of about 5 million people who have been vaccinated.
But remember, this is also self-reporting, correct? Depending on what we are doing and what we are. So the reality, we need to be careful about how we interpret these data and these resources. Well, the best data that we have, either when we have a population-based data like we have from Israel, or when we look at clinical trials and we have a follow-up on all the patients who have been vaccinated and what has been the failure rate. This provides us with the best baseline to understand the efficacy of a vaccine. Here, we don't have population-based kind of information. It is not like we collect information on every single person that would have been vaccinated. It's self-reporting. And this is where we need to be careful of how we interpret these numbers.
Thank you.
Thank you. All right. And the next question is from Lisa. Lisa, if you could go ahead, open your mic, tell us what outlet you're with. And then folks, if you have a question, get me a message right away, because we do have to get Bob and Adnan onto their next meetings pretty quickly. So go ahead, Lisa.
Thank you. I'm Lisa with MERS News, and I had two questions. First, can you quantify how many of the 100 inpatients have which variant, if that's possible? And second, how is the hospital administration addressing the staff or nurse burnout as they continue to deal with the increasing numbers of patients and the double work shifts, that kind of thing? Thank you.
So I can address the variant question, and then Bob will address, some of the things we are doing with respect to burnout, both for nurses, providers, and the rest of our staff. So this is a very critical and important topic. With respect to the variants and which one we are dealing with, these are usually determined and tested at the state level. And we know that currently the infections that are related to the Delta variant exceed 90%, and most likely in most states 95%. And these are the things, and not everyone get tested. They kind of survey certain numbers and see what it is that is looked at, but this is where we probably are looking at with respect to these numbers. Bob, I'll turn it over to you for the discussion of the burnout.
I would tell you that the majority of our nurses are energized by the fact that we are continuing to be very assertive at sending our messages out to the community to partner with them by getting vaccinated and by mask wearing indoors. And they look to us in many ways as assistance, if you will, in their process, because one of the things that they are very frustrated by, and I talked to some nurses just this last week in our ICU, at treating very ill young, unvaccinated individuals, and it puts an incredible stress on themselves. So the more that we are getting the message out about the importance of vaccination, that is one way that we are actually helping them. Other ways are looking at everything from our staffing and our scheduling to give as much creativity as we can for time off. As I mentioned, the job fair that's going on right now, really just making sure that we've redirected all our resources as appropriate to helping with making sure that our hiring processes are easy and that are working effectively. We've offered incentives to our nurses, financial incentives, as well as help in supporting by referring other individuals to come work for us. We're doing rounding daily with our nurse managers and nurse leaders, and we're providing a lot of employee assistance support, meaning just, trained counselors that can help them deal with the stress, that can help them deal with the grief, with what they're seeing, with their frustrations. So there's no one answer. We're trying to just do a myriad of things to help them through this.
Thank you. Thanks, Bob. And folks, or Adnan and Bob, I didn't get a chance to tell you, but I will take this opportunity in front of our friends in the media to tell you that I was speaking to two friends who are nurses at another hospital, and they were saying, well, I wish that our leaders would do what Henry Ford did and require everyone to get vaccinated. So I was very proud at that point to be part of this organization. That is all the questions that I'm seeing right now. Gentlemen, any closing remarks before we wrap things up?
The only comment I would make is that when people are tired, they look to asking themselves, well, what good does it do? And, they'll also focus on a breakthrough case they've heard about, as a reason to perhaps not get vaccinated or as a reason not to mask up. But I think it's important to look at how much gain we've actually made. We have handled this virus, each surge, better than the last, both in terms of the treatment that clinical teams have developed, as well as just minimizing the numbers by people doing the right thing. So, you can look at what's gone wrong, but I think we have to step back and look at a lot of things that have gone right and encourage that kind of behavior. And then just remind people that variants change and find ways to get through. Our job's to stop the variants from being able to form.
Thanks, Bob. That's excellent perspective. Dr. Munkarah, anything? I don't mean to put you on the spot if you have to get moving.
Not at all. The only thing I would add is remember that not too long ago, our hospitalization rate was multiple fold what we are seeing now. This was in April of May of this year, 3 or 4 months ago. And there is no question that the fact that our hospitalization numbers continue to be on the lower side, significantly lower, and this is not only at Henry Ford Health System, but across the state, is because of the fact that we had significant number of people who got vaccinated. So we have every single piece of evidence to show us that vaccinations do work. And we have plenty of data now. And this is how Pfizer got, again, the FDA approval yesterday. They went through a very judicious kind of work and review. And it is, again, prove and support the fact that these vaccines are safe. So let's again make sure that all of us have all the information, the correct information. People are trying to kind of use all kind of what we call, calculation acrobatics to kind of interpret things. The reality, the data is very, very clear. The vaccines are effective, they are safe, and they are protecting people who are getting vaccinated. And we hope that more people get vaccinated so that we can protect the whole community.
Thank you. And with that, I'll let you all go. Thanks for joining us this afternoon. And Bob and Dr. Munkarah, thank you so much as always for your time. Truly appreciate you and your leadership.
Thank
Take
you
care,
all.
everybody.